For Action News, I'm Anna Dolosky. Some relatively good news about e-cigarettes. House Republican leadership is urging the FDA to loosen its grip on the e-cig market. Back in 2009, the Family Smoking Prevention Tobacco Control Act passed, giving regulatory authority over tobacco products to the FDA. The agency then deemed electronic cigarettes a tobacco product, even though they contain no tobacco at all and emit no smoke. And they didn't stop there. They determined that products introduced to the market after a grandfather date of early 2007 would have to reapply to stay on the market. The letter of reconsideration by Speaker Boehner and others is urging the FDA to loosen those guidelines and allow products on the market to reapply without much complexity, possibly even saving some small businesses from bankruptcy. Here's ACTIA's Dr. Gilbert Ross with more.
E-cigarettes only came into existence like 10 years ago, and they only hit our shores 7 or 8 years ago. And only in the last few years have they really taken off as a substitute for toxic, addictive smoking. So nobody knew quite what to do with e-cigarettes. So the FDA, after thinking it over for 4 years or so, last April, deemed that these e-cigarette related vapor products are to be regulated as though they were tobacco products. The FDA's proposed regulation would require any of these products on the market that were introduced after February of 2007 to go through a whole bunch of regulatory hoops to be approved to stay on the market. So basically we're talking about the whole e-cigarette industry. Now what is the e-cigarette industry? The people at the FDA and the CDC and University of California, San Francisco, and other American Lung Association, American Cancer Society would have you believe that e-cigarettes are a ploy by big tobacco to addict the new generation of youths to nicotine and get them smoking again. All of the evidence, the data, the statistics we have say that the exact opposite is true, that smokers are getting off of deadly cigarettes by using e-cigarettes and vapor products, and that includes teens. So we strongly support the urging of the House Republican leadership in this case to ask the FDA to bend their stringent rules on allowing e-cigarette products on the market with an easier access. The American Council on Science and Health, as anybody listening to this knows, is strictly apolitical. We don't support Democrats or Republicans because they're Democrats or Republicans. But when we hear mythology that's counter to public health, we call it out. And it just so happens that most of the anti-e-cigarette mythology we've been hearing for the last couple of years has been coming from the Democratic side of the aisle. And in this particular instance, it's the Republican leadership in the House that's supporting public health, we believe. So we support the letter signed by Speaker Boehner. Hope that the FDA and the H2S will listen to them.
To read more on this story and others, you can head to our website, action.org. And while you're there, don't forget to also sign up for your daily dose of news delivered straight to your inbox. For Action News, I'm Anna Dolosky.